Yes. Welcome back. We've missed you, and we're so glad to see each of you here with us at the Stones River Country Club, as well as our virtual audience. So I'd like to welcome you to the official September 14th meeting of the Rotary Club of Murfreesboro. Now, I just reminded myself, and with the assistance of Hope, to silence my cell phone. So if you'll join me in that, I will appreciate it. We're now ready for the prayer, pledge, and four-way test. That's my responsibility today. And fortunately, I received the Good Day Ascension publication. And this month, as we continue celebrating life day by day, there is a prayer here in honor and recognition of the members of the healthcare profession that we have lost in their service and sacrifice in fighting COVID. And Gordon, if you don't mind, I want to share this prayer with our club. So please join me in prayer at this time. God of peace and strength, we come before you today to remember your faithful servants who live lives dedicated to healing, compassion, and service. As we remember these ones who have entered into your presence, we pray that our memories of them, their work, and their passion might remain sources of strength for us. May their examples of courage deepen our courage. May their examples of joy enliven our joy. May their service to others inspire our service. In remembering and honoring them today, may we find comfort in one another and in your loving presence. We ask all this in your holy name. Amen. Could you please join me for the pledge? I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, liberty and justice for all. And now for the four-way test of the things that we think, say, and do. Number one. Number two. Number three. And number four.
Official.
Thank you. We're ready for Miss Nancy and her report at this time. Please continue enjoying your lunch.
Well, good afternoon, everybody. It's nice to see folks again. We weren't here last week. We don't really have any guests other than those with our speaker, so that's good. But we've got lots of Rotarians. Some we haven't seen in a while, so it's nice to see faces here. I got a couple of things, but first we want to do September birthdays. If you have a birthday in September, would you please stand? Oh, did you get your birthday card? Okay, I see some people shaking their head. All right. Well, let's sing happy birthday. Happy birthday to you. Happy birthday to you. Happy birthday, Rotarians. Happy birthday to you. And I hope you have many more. All right. A bit of business. You have been great about signing up to do the prayer, the pledge, four-way test, and help at the desk. But I would ask, please, if you cannot do it, don't just tell Chantho when he calls, well, I can't do it today. Please have someone else contact another Rotarian, ask if they will do it for you, get back to Chantho and let him know who that is, because we worked hard to get this list the first time. And if you signed up, then you accept a little bit of responsibility for finding a replacement. So I'd ask that you please do that. People have done a great job, so thank you. But that's a little thing we just need to remind folks of. Next, dictionary project. Who is familiar with the dictionary project? Every Rotarian should be. We have, oh gosh, I don't know how many years now, provided dictionaries for every student in 3rd grade in Cannon County and Rutherford County. We're getting ready to do this again. Now, last year and this year, unfortunately, we're not able to go into the classroom to give these out to the kids and to do any kind of presentation, but we do need volunteers to pick the dictionaries up at Patterson Community Center. Gloria has worked out to get stickers in all of them. You pick them up at Patterson Community Center. You contact the school that you've signed up for, and you literally drop them off at the school and you're done. Now, we've already had a number of people sign up. That's great, but we've still got some openings. So if you would like to sign up, I'm going to pass these around. The sheet on top is the contact person for that particular school. Lots of people have just made a picture with their phone so they can actually blow it up and read it. So I would suggest that you do that. But we would appreciate doing this. The kids, it's amazing what the kids know in 3rd grade. And you'd be surprised if you've not been in the classroom to see them, how excited they are about getting a dictionary. So thank you. Anything else? Yes. So thank you to the Rotary Club, right?
Thank you, Miss Nancy. We're excited about our theme this month is Healthcare Heroes. And as we continue to celebrate all of the different themes, we want to first recognize any announcements regarding Family of Rotary. Any announcements regarding Family of Rotary? Yes, ma'am. And we're excited to be able to work with Grace and looking forward to a future announcement as possibly one of our junior reporters in the Interact newsletter that we're working on currently. Now, our recognition of guests we have with us, you know, our theme is celebrate. And one of the key words in celebration is the word of hope. And I am just excited to have to introduce our guest from Ascension Saint Thomas, who is visiting with us today, Miss Hope. Could you please stand? She is a nurse there, and your official title is what?
I'm now in business development.
Okay.
Yeah, but I was a labor and delivery nurse.
Yes, she's in business and development, and you know what that means, right? She has my dream job. I always wanted to be a nurse. There's no one more compassionate. So we're just excited that you're here with us. And you have been a part of Ascension for 5 weeks,
Yes.
correct?
Yes.
So welcome to Murfreesboro and welcome to our healthcare community. Now, football's everywhere. I can't get away from it. So we're now ready for our sports report. George, do you have anything you'd like to report?
I don't see John here. You know, I had a Rotarian tell me how much fun it was to watch Dietrich and myself giving each other grief. And I want y'all to know that Vanderbilt has a horrible football team. We're still a baseball school, and we just found somebody last weekend that was worse than us. So that's not anything. The YouTube that I sent to Frank this morning that was fabulous was that I thought about John Hinkle. Where did John go? There's John. I thought about John. I said, it's a David and Goliath kind of moment when Jacksonville State on the last play of the game beats Florida State. And I know that there are people that are big Florida State fans, but I don't see Coach Stock in here, so we're good for today. But that was, if you get a chance, just YouTube it. That's what Frank tried to do, but it just wouldn't work. Okay. It'll be on Facebook tonight, but it's just one of those feel-good kind of things where little guys can beat big guys, and that's just a really fun thing. And Oakland High School, this is not just a college sports report. Oakland High School has done such a good job with beating everybody in their path that 2 of the teams that they were to play have forfeited this year, just said, we don't want that. And so now they're trying to recruit. There's an article in today's paper where they were trying to recruit another private school to come play them. So it's just really gotten so that they're so good that nobody wants to play them, and that's a lot of fun. Thank you.
Thank you, George. Now let's showcase our service project. So I'm going to ask if Barb Sutton will come forward and Phil King with Foundation Football. And then John Mitchell will just do 3 in a row regarding Beyond the Bells. So if the 3 of you could come forward and share your information about the special events that we're working on.
Well, it's time for the Murfreesboro Middle Half, and I need your help to volunteer. We have 20 spots we need filled. It's October 9th from 6:30 to 9:30. We will have coffee and donuts for everybody that day. Make sure you have your vests and your flags. The bad news is, in a way, I will miss y'all because the good news is I'll put my dollar in. My daughter's pregnant with her first child, and we're having her baby shower in Huntsville that day. So I will be in Huntsville, but Lisa Nolan has graciously volunteered to make sure y'all have hot coffee and are fit. So we're good. So please sign up. We have 20 spots that we need to fill. Bring friends, family. You'll get credit for attendance if for the hours that you work. So please help us. Oh, this is a fundraiser for us too. So we get $1,200 for manning our section of the race. Thank you.
I'm going to try to have a impactful but brief announcement about the Beyond the Bells. So I'm going to ask everybody at the count of 3, repeat after me and say beyondthebells.org. 1, 2, 3. Beyondthebells.org. Now you know how to support the Salvation Army by going online and signing up to be part of our broadcast on the 14th or making your donation. Thank you.
First, a big thank you to those of you who signed up for Foundation Football. I do want to say that after 2 weeks of college football and 1 week of professional football, our club has generated over $440 towards our foundation. Leading the pack is our own healthcare hero, Dr. Tom Woolahan, at $29.90. Coming in a close second is our own Assistant District Governor, Melissa Cassidy, $28.40, and third is Nancy Smith with $27.50. And Betty, I see you on Zoom, or I did. Yes, I got your email. Betty was so excited that her college choice, Oregon, beat Ohio State in a thriller of a game. And so she racked up a win and all the points that went with it. After 2 weeks of college football, the leader in the clubhouse is John Hinkle. However, what college team did John Hinkle choose? It was not Auburn. It was not Auburn. John Hinkle, do you know who the running back is for Auburn right now, the true freshman running back who is after 2 weeks set Auburn rushing records. Why? It's Warquez Hunter. And what is Warquez Hunter's hometown? Would anybody want to take a guess? Why? It's the same hometown as mine, Philadelphia, Mississippi. But John Hinkle's college choice was Presbyterian College. They have scored over 130 points in 2 games. 84 points week 1. He was the leader by far. And then Saturday, I think, was 70 or 74 points. Hinkle can pick a scoring machine of a team. And so after week 1 for the professional, we have a tie. The Arizona Cardinals and the New Orleans Saints have both earned $8.80 for their people. Again, look forward to next week. Thank y'all for playing.
Thank you, Phil. And please keep the dates in mind for all of our special events. And now for the star of the show. We've got a great agenda today, program agenda, in celebrating hometown heroes. And as you know, we owe a really big debt of gratitude to all of the members of the healthcare profession. And Gordon, we are grateful to you for the outstanding leadership that you are providing and have provided in the past and continue to do that. Gordon has agreed to introduce each of the 3 speakers this month, and we continue to be grateful to Amelia and Gary Dennis for your job in helping to make these opportunities possible. So at this time, we'll ask Gordon Ferguson to share his information.
Thank you, Lori, and thank you for the opportunity to recognize our healthcare heroes. I'm not sure when we first talked about doing this, but I'm pretty sure we didn't imagine that we'd be in the state of affairs that we are right now with this recent COVID surge with the Delta variant. I want to just say again, thank you for Hope for being here. Each day as we go into the hospital, we have to get this little dot to put on our cars to indicate that we don't have a fever, that we don't think we've got COVID. And the individuals who do that got creative. They started putting a word on each of the dots. Yesterday's word was hope. And this morning I get up and I do my swimming over at MTSU at 6 o'clock in the morning. And some people just put dots all over the badge. I just got to have 1 dot. So I find myself taking that dot with hope written on it and throwing it in the trash can. I thought, well, I feel like I'm throwing hope away here. That's not a good way to get my day started. So hope turned back up and here we are. But we're glad to have Hope on our staff working with the Ascension Saint Thomas Alliance. Before I introduce Dr. Lichaa, I would like just to take a few minutes to give you a quick update on what's going on at the hospital. I know, Phil, we did this before, and honestly, I would not have predicted back then what we would be dealing with as we went through the summer into the fall. Today, we had 119 COVID patients in the hospital. That's down from about 145 last week. Of those 119 patients, 40 of them were considered in critical care. Keep in mind that we've got 32 critical care beds. So we've got more critical care patients than we've got in our unit. So we are caring for about 8 of those patients in our recovery area located next to surgery. Last week, we made the decision as a system to curtail any non-urgent elective surgery cases. And as you can imagine, that is not an easy decision to make, not just from the hospital's perspective, but also from a patient perspective and the physician perspective. Everybody has planned for that date and they've got it in their mind. That's the day I'm going into the hospital for surgery. And then lo and behold, they get a call from us or the physician's office to say, sorry to inform you, but we're having to postpone your case. But we have got to do that, not just from a space perspective, but frankly, from a staffing perspective, because what we've done quickly right around the Labor Day weekend, we've started figuring out what nurses and other staff could be moved from surgery to help in critical care, to help in the ER. And everybody is really bending over backwards to make sure that we've got the right staff where we need it. Of the 40 critical care patients that we have in their hospital this morning, 28 are on ventilators. And unfortunately, with the Delta surge, we're seeing a trend that when you are placed on a ventilator, your chances of survival take a significant drop. So we're doing everything we can to keep patients off the ventilator. We've got different machines that provide that high flow density oxygen, but some just reach that level that not even that is enough. And we've got to intubate them and then place them on a ventilator. The average age of our COVID patients right now is in their early to mid 40s, significantly different than what we saw about a year ago when this really took its toll on more of the elderly population. When we look at our mortality numbers, the average age of those that are passing away currently is 48 years old. So this is really taking a toll on our staff. I won't mince words there. It's really difficult for our nurses who work hours and hours and hours and our physicians, only to see these patients eventually have to come off the ventilator because they're not going to pull through. I wanted to share this with you just for a couple of reasons. Well, three. One, just to update you on where we are, but also just to let you know that 96.2% of our current patient population is unvaccinated. Just say that again, 96.2% of the patients that we've got in there today with COVID are unvaccinated. So I'm going to make a plea, whatever your political preferences are, to please believe the science, please believe the medical community. And that message is that the vaccinations are making a difference and have made a difference. And we would like to do everything we can to continue to see the vaccination rate increase. And then secondly, and finally, really to ask you to keep our staff in your thoughts and your prayers, just as we're doing here today. They don't really consider themselves as heroes. Many feel this is what they were called to do. But frankly, when you see what they're having to deal with, the patients that have COVID, they can't have a visitor, they can't have a family member there unless we make an exception. So what communication they have is usually over their phone or an iPad, where we hook them up to their family. So it's a very lonely and scary time for them. And then also just to recognize our community. Just today, we had the Alley on Main provide lunch to a good number of our staff that are working with our COVID patients. And there are countless other examples of churches and other organizations that are reaching out to our staff to give them the support that, quite frankly, they deserve. And I want to just thank any of you that have been connected with those efforts for your taking the time to do that for our staff. So that's kind of a Debbie Downer, a part of my short presentation. What is extremely encouraging is the fact that we continue to recruit outstanding providers, physicians into our community. And it's my privilege today to introduce to you Dr. Hady Lichaa. Dr. Lichaa is part of Ascension Saint Thomas Heart. He has been in our community now for about 2 years. Dr. Lichaa is what we refer to as an interventional cardiologist. He was trained, first of all, in medical school in Beirut, but completed his residency and his internship and fellowship in Cooper University Hospital at University of Medicine and Dentistry of New Jersey. I would describe Dr. Lichaa as one of our more ambitious and aggressive interventional cardiologists, and rightfully so, as he is well published in literature literally across the world in terms of some of the techniques that he uses to access different vessels and things like that he'll share more with you. But we are blessed to have Dr. Lichaa in our community with his wife, Lara. They have 2 kids that both go to St. Rose. And Dr. Lichaa, I'll hand it over to you. Thank you.
It's a pleasure to be here. I'm blessed to work at St. Thomas Heart, and it's been a wonderful journey for the last couple of years. So my job is called interventional cardiology. I basically fix heart arteries and heart abnormalities without open heart surgery. Most of the time, the biggest development that I'd love to share with you over the last few years is going from the wrist to the heart, which is not only convenient for patients, but also is associated with much better outcomes, much less bleeding, much less complications. The patients sit up immediately and they can go home on the same day after having a heart intervention. I'm as passionate about interventional cardiology and all the advancements that we've had over the last few years, but also about prevention of coronary disease. So we don't want to get to a point where people are having heart attacks. I'm as passionate about preventing that. And obviously, I'll welcome any questions. It's a major topic, and I'd love to get any of your questions. But going back to St. Thomas Heart, we are blessed that we were able to establish through the leadership of Gordon a very advanced interventional cardiology program that deals with very advanced heart conditions. We have already done something called atherectomy, which is basically a drill that we use inside the heart arteries from the wrist to get through one of the most difficult blockages in the heart. And the large majority of heart blockages are now fixed without open heart surgery, which are being done here at St. Thomas Rutherford. The other good news is that thanks to all the efforts of a lot of people, we were able to get the certificate of need for cardiac surgery, which is a massive development in our world, which not only allows people to get their heart surgery if needed here. I'm talking about open heart surgery and a small minority of cases where this is absolutely needed, but also this will allow us to even become more aggressive from our standpoint, because the hospital would have all the backup options that is required to do so. So we are ready for that. The other aspect that I'd love to share with you also is that there's an artificial heart pump that is placed from the groin into the heart that we have implemented here at St. Thomas Rutherford for patients who are very sick. And this will allow them, it will allow to take over the heart function for a few days in order for the heart to recover. So all of these technological advances are being placed through a tiny, tiny little hole in the artery, which is not even requiring one suture. So I thought I would spend the rest of the time answering questions and opening it up to you if you have any questions about the program.
What's the next stage of growth?
So in my last 2 years of being here, I've witnessed an unbelievable growth just by the interventional cardiology service. So the next stage would be cardiac surgery, and obviously, ultimately, advanced heart failure options, which would be artificial heart pumps and things like that. But once we have heart surgery, this will be a major milestone in the development of advanced heart services. Right now, we are able to do most of the advanced interventions, but there's a small minority where I still have to go to Nashville to do them there. But once we have heart surgery in the building, we'll do all the interventions here. So. So commenting on the first question, the fish oil question. Fish oil was really big a few years ago. In the last 3 years, we had a lot of literature that did not show any significant benefit for the over-the-counter fish oil. But the good news is that there's a derivative of fish oil called EPA, which is a special fatty acid found in fish that has the tendency to decrease heart attacks by 25% in people who have high triglycerides, which are fats in the blood, between 150 to 500. That study called the Reduce It trial showed a significant 25% decrease in heart events in patients who have that. So technically, I wish the over-the-counter fish oil does the same job. The problem with the over-the-counter is that you need 20 capsules in order to get the quantity of EPA that is in that prescription drug. And taking 20 capsules is not only inconvenient and massive, but it has also things that can raise the bad cholesterol. So not that fish is amazing, but when you take it in such huge quantities, it would not be optimal. The second question about certificate of need, I'm going to have to apologize. I'm not familiar with the politics of the state. Maybe Gordon probably can answer that question.
Yeah, I'll just briefly respond that through the last few years, the certificate of need law in Tennessee has gone through quite a bit of reform. You're right, there are a good number of states that have no certificate of need regulations. Tennessee, for as long as I've been working here, has had that stipulation. The concept being that with healthcare being so expensive, hospitals, equipment, that there was a regulation on licensed beds, on certain high-end medical equipment. The last reform done earlier this year did have quite a bit of sweeping changes that drop certain requirements for certificate of need. For example, on licensed beds, if you already have licensed beds in a particular location and you want to add additional beds, you no longer need a certificate of need to do that. So I think it's going to continue to evolve over the years, but great questions. Thank you. You know, I can tell you on the open heart surgery, Amelia, that it's dependent on us recruiting 2 cardiovascular surgeons, and we want to make sure we get the right 2 surgeons, just like we got with Dr. Lichaa here. Our target for that is January of 2022 to get that program up and going. Where we go beyond that, as technology changes, but as Dr. Lichaa mentioned, we've got the foundations in place. It wasn't that long ago that we just started doing the interventional cardiology work, kind of pioneered here by Dr. Brett Miaton, and Dr. Lichaa has just come in and built on that. And then The work we're doing with electrophysiology, cardiology, that's also continuing to grow. So who knows where we'll go after the CV surgeon. Dr. Lichaa may want to add to that.
Yeah, so I can tell you what we have at the hospital here is extremely special. From a physician perspective, we have everything we need to grow and to have, first of all, the staff is unbelievably talented. We have all the equipment that is available in the major cardiac centers in the United States. We have already, worked on pretty sick patients who would not have made it otherwise. And soon enough, you're going to see most of the interventions done in Nashville done here. So right now, I would say almost 50% of this high-risk PCI is done here because we have to obviously be mindful of a few health conditions. But beyond that, once we have all the infrastructure that we need, there's no stopping. We're going 100%. Yes, sir.
So most of the folks here know I've got quite a few children in my household. If that's the case, sometimes circumstances dictate that you gotta take drastic measures. I had to take my 2 1-year-olds to the doctor's office by myself yesterday for some shots. Unfortunately, I just went to double stroller, so I was sitting there arm in arm with 2 1-year-olds on the way in. That's okay. On the way out, I was really up and bumping up that hill in my car, and I thought to myself, some of these stories of these, these visually healthy people just taking over from a heart attack, and they're trying to make it in my car. What's the best way to screen, to make sure you don't have some kind of.
Excellent question. So obviously the heart is very tricky because just the scientific basis behind that is the nerves that innervate the heart that allow the heart to send messages to the brain to tell the brain, hey, there's something wrong, are very dispersed and very non-specific. And you can see, you hear all these stories, someone had nausea or dizziness, ended up with a heart attack, or shortness of breath without any chest pain, without the typical chest pain that you see in the movies and things like that. So that's the part about the heart care that is very tricky. So your question is very much on point. There are a lot of other symptoms that are associated with the shortness of breath that indicate that there may be a heart problem. First of all, it would have to happen with exertion. So some people who are short of breath and they're wheezing, they're coughing, obviously this would be a lung problem. People who are short of breath without even moving could be a blood problem, red blood cell problem, anemia, etc. So it would have to be an exertional issue. Number 2, it should be usually associated with other symptoms like shortness of breath when someone lays down, or leg swelling, which is another aspect that the pressures in the heart are elevated and it's backing up into the legs. So there are a lot of other clinical signs that we can detect by exam and by electrocardiogram, echocardiography, etc. But I wouldn't say everybody who's short of breath, carrying a 2 1-year-old needs to see a heart doctor, that's for sure. So obviously your family doc would be the kind of the screening doc who would think, is this a heart problem versus not? But it's very important to think about prevention. As much as I'm passionate about all these advanced tools and gadgets that we use in the heart, I'd rather someone have a good diet and exercise and stay healthy rather than suffer from all these things that require advanced heart options. So. Yes, ma'am.
Helen, that's another really good question. Our ER certainly has been busy seeing a good number of COVID patients coming in. We are not and don't hold ourselves out to be a pediatric hospital. So any kids that really get sick with COVID, you're typically seeing them being transferred up to Monroe Carroll Hospital. What I think we're hoping for is the work being done so that vaccinations will soon be available for kids that young. So again, and I don't know, Dr. Lichaa, if you sort of take a stab at that one too.
for sure the Delta variant, I'm not a pediatrician, but my wife is. So that's right. I should call her. But the Delta variant is specifically worse for kids below the age of 12 than the initial variant of COVID. There have been a lot of surges in kids requiring ventilation, breathing machines, which was not really the case before. It used to be a very benign little fever in a kid, and that's it. The Delta variant is way more aggressive. And the other aspect that has to do with the heart is we've seen clots in massive amounts. This virus infects the lining of the blood vessels, every blood vessel in the body. So if someone has predisposition for forming clots, not only that, the virus itself causes inflammation to a point where clots can form both in the veins and the arteries. So we've been seeing this even in kids and in adults, heart attacks with multiple blockages that we've never seen this happen at the same time, clots in the lungs. So it's real. People who think it's like the flu, it's not like the flu. People are literally dying from it in their 30s and 40s. So, yeah. Yes, ma'am. Long-term effect, cardiac, yes. So COVID affects the heart in multiple ways. One of them is clotting in the heart arteries. The other way is in a rare, I would say 1 in 10,000, it can infect the heart muscle itself. We call this myocarditis, and there will be fluid around the heart and the heart muscle weakens. Most of the time it's self-limited and it doesn't lead to heart failure, but there's a small subset that leads to weakening of the heart muscle, which requires at some point heart transplant and things like that. As far as COVID symptoms, we have seen in clinical practice, obviously we're learning as we go, people take a good 6 months sometimes to recover from an event, especially if they have heart disease to start with. The inflammation that this virus is causing, and not only in the lungs, but all over the body, is inducing long-term fatigue syndrome, which the body has to heal from an immune system standpoint and heart failure standpoint. So long story short, blockages in the heart arteries, heart muscle dysfunctions, AFib, atrial fibrillation, which is an irregular heartbeat, and fluid around the heart, and chronic fatigue syndrome. Yes, sir. My pleasure. The approach that's close to that is like smoking, basically. So if you really want to convince someone about stopping smoking, in some individuals, it depends on their mindset, they'd be scared to see the amount of people who are dying from it. So I would gauge, everybody is different. So if you're in a conversation with someone, if you feel that they're reasonable, they're willing to engage in a scientific discussion, then the inflammation that's killing 30 and 40-year-olds right now in every hospital in the United States is the biggest thing that I would think would convince people. But if you think it's more of an ideologic discussion, then I would focus more on the sources of information, because most people who get their information and all the conspiracy theories and all that are getting it from the internet without any scientific authorities behind it. So I would ask them to refer to these websites, the real medical websites, rather than Google and all of that. It's a very deep conversation, takes a while, but whatever you can help us with in the community, we'd really appreciate it.
Let's give him a hand, please, Dr. Lichaa. Dr. Lichaa, we have a certificate for you as speaker, and also a donation has been made in your name to continue to fight to eliminate polio. So thank you so
Thank
very
you.
much for your service, your sacrifice, and your commitment to excellence. Thank you. Okay, now we recognize that our theme is celebrate and happiness is a choice. So today we have our featured members to share with us some things that we need to celebrate this week. Phil and Megan, could you please come up? And while you're en route, I want to thank Frank for working his magic this week to get the information out, the newsletter out to our virtual audience. Frank, there's no way this could have been done without you.
All right, everybody. For the week of September 12th through the 17th, we have several things to celebrate. For example, we have two things on September 12th. On September 12th was National Grandparents' Day and National Video Games Day.
And on September 13th, we had National Peanut Day. So if you were a peanut lover, yesterday was your day.
And today, Gracie's birthday, is National Cream-Filled Donut Day.
And tomorrow, if you're crafty, it's National Make a Hat Day.
On September 17th, it is National Prisoner of War or Missing in Action Recognition Day.
And last but certainly not least, on Saturday, you better fire up the grill because it's National Cheeseburger Day.
Thank you again for all of your support as we continue to move forward in battling all and having to find ways to mitigate battling the COVID virus within the community. We greatly appreciate everything that you do. Let's go in love, go in peace, and go in unity.